Good afternoon. We're just waiting for everybody to come on. Before we get started, I want to let everyone know that today's virtual forum is being recorded, and live captioning is also provided. If somebody needs captioning, all they need to do is click on the toolbar at the bottom of the screen. If anybody would like a copy of the recording, they are welcome to email the Ohio Olmsted Task Force at ohioolmsted@gmail.com, and I'll post that email address in the chat. Okay, so it looks like everybody's on. So I want to say welcome and good afternoon. Welcome to our Direct Care Workforce Crisis Virtual Forum. I'm Katie Hunt-Thomas, and I'm the Director of Advocacy and Disability Rights Attorney here at the Ability Center. This forum is being organized by the Ohio Olmsted Task Force, along with the Ohio Centers for Independent Living, one of which is the Ability Center. The OOTF is a coalition of Ohioans with disabilities, advocates, and organizations working to promote the right to live, work, and participate in our communities. Today, we want to raise awareness of an issue that's been happening for many years in Ohio. For many years, people with disabilities have struggled to find reliable, direct care workers that will allow them to remain independent, avoid institutionalization, and age in place. In-home care is the glue that makes independence for many people with disabilities possible. Without it, many people cannot work, go shopping, or socialize independently and in their own home. Yet, despite advocates' attention to this issue, Ohio agencies have done little to alter the current system that fails to properly develop and reward the direct care workforce. The Ohio Olmsted Task Force is asking that we change that Ohio find a way to eliminate the tedious bureaucracy, increase wages, provide benefits and educational incentives, and recruit those called to provide health care to this field. Direct care workers are also known as direct support professionals, home care workers, job coaches, and many other titles. And they help people stay out of unnecessary nursing homes and assisted living facilities. Direct care workers provide hands-on care to people that need help with daily tasks. They bathe, feed, remind, teach, befriend, and drive. Because of them, people with disabilities can go to work and school, stay active in their family, church, and community. They are the backbone of any personal care plan. But unfortunately, that work is often part-time, without benefits, physically demanding, and grossly underpaid. The COVID pandemic has made the crisis even worse. The Ohio Olmsted Task Force believes that the lack of access to in-home direct care is the largest barrier to independent living for people with disabilities in Ohio. We hope this forum will increase Ohio's attention on what we need to do to fix the direct care system for our friends, neighbors, and families. For the forum today, we have a wonderful group of panelists. First, we are very pleased to have some of the people struggling with this crisis with us to share their stories and highlight problems they face in finding and keeping direct care workers. I'll have everybody introduce themselves in a little bit later, but we have Renee Wood, Jeremy Bigelow, and Tammy Reardon, who are going to share their stories and talk a little bit about the direct care crisis. For the forum, we also were honored today to welcome Representative Lisa Zabecki and Representative Jim Hoops, who are here and listening as we invited legislators to be here today. So first, we are going to hear from our panelists that will share how the direct care crisis has impacted their lives. Following that, we will have time for other panelists to ask questions and share any comments they might have. We'll also have questions available in the chat if anyone in attendance has questions or comments once the panelists are done speaking. With that, we'll move on to our panelists. The first question that we have for you today is, tell us about yourself or the person that you represent and the impact the direct care worker crisis has had on your life. I'm going to ask Jeremy, do you want to get started?
Sure. Hi, everybody. I'm Jeremy Bigelow. I'm here in Toledo, Ohio, and I am a spinal cord injury. I'm a C3, C4, and my accident was just over 11 years ago. Um, I was in a car accident, which left me totally dependent on somebody at the drop of a hat. I was super independent before. And now, because I have no arm or hand function, and I am bound to have in a wheelchair and have everybody or somebody do everything for me from feeding to bathing um, and transportation. And the lack of care that I've been receiving and the lack of help out there in the community is a huge struggle just on a day-to-day life to get things done. So needless to say, I feel like this has kind of been falling on deaf ears, and this is something that needs to change right away. And as a board member of the Ability Center, I hope we can come up with a plan to make some changes.
Thank you. Renee, would you like to introduce yourself and tell a little bit about how the impact the direct care worker crisis has on your life?
Hi, my name is Renee Wood. I've been very active in the community all my life. I live at home with my 78-year-old husband who uses a walker now, and he has multiple health issues. Last year, my husband was hospitalized twice, and it was tough finding people that assist me. I have enough hours for my care, but it's hard to find people that cover those hours for $11 or $12 an hour with no benefits like health insurance. We can't, when we can't fill these hours, my 78-year-old husband has to do all my care. And it's become dangerous for both of us. I broke my arm in 2019 because of the lack of help. The stress is off the charts, not knowing what you're going to do if it becomes impossible for your husband to do what you need. I need to be dressed, bathed, showered, and fed, and someone to take me to anywhere I need to go. So it's very difficult.
Thank you. Tammy?
Hi, my name is Tammy. I live in Curtis, Ohio, and I'm here representing two sons, one of which lives with me in Curtis, and the other lives on his own in Oregon. The lack of care has really taken a toll on my son in Oregon. He is deafblind, and he relies on the care for doctor's appointments, to get to work, to go to the grocery store, anywhere he needs to go. He has enough hours to cover, but cannot keep anybody there. Every time we get an agency with the direct care workers, they're quitting and going to other places to get jobs, and then he's stuck without anybody. So something really needs to happen here. My other son, if his care workers do not show up, I have to miss work. And then that takes a toll on me not being able to pay the bills. And I'm trying to juggle care for both of them and still work on my own. it makes it hard.
Thank you. The second question we have is more of an educational question for the audience. We want to know, how do you or the person you represent use direct care workers? Why are they useful? What do you use them for? Tammy, I'm going to call on you first.
Okay. So again, I have two. So one, he relies on them for everything, everything except dressing himself. So they administer meds, cook his meals, help him go to the bathroom, just anything he does, they help with everything. And my other son, they help him with transportation is a big one, getting him to the grocery store, doctor's appointments, to work, help him with light cleaning. And a real important one is making sure he takes his medication.
So then what happens if the direct support worker doesn't show up for work?
Well, I'm there, but if I'm not available, then they go without anything. So it really takes a toll on my son that lives by himself. It takes a toll on his mental health because he can't go anywhere because he can't drive. There's no public transportation in his area. There's no sidewalks in his area, so he can't just go out and walk to the store.
Thank you. Jeremy, how do you use direct care workers, and what do they do for you?
I utilize direct care pretty much. Well, I have 12 hours of care per day, and they're there to help do range of motion, to help reposition me, because pressure sores are a big risk for someone that's not able to move themselves, from feeding to bathing. Pretty much anything you think you need to do, I have to have somebody there to do it for me. Yeah.
And what happens if they don't show up for work?
Well, unfortunately, Tammy was just talking about mental health. It's scary when you're not able to, when you know where you think somebody's supposed to show up and someone doesn't come to help you, and you don't know what you're going to do that day, if you're going to be able to get out of bed, if you're going to be able to eat. I do live with my dad, and unfortunately that all falls on him. So he has to miss work, and an opportunity to pay the bills. And it all falls back down on my friends and family. And they have to drop everything at the drop of a hat, because that's what they have to do. And unfortunately, they're the emergency plan that I have to implement, that insurance says I have to implement, because there's no accountability for aides that don't show up, and agencies don't tend to really care if, they try to make phone calls and try to find somebody. So it's tough not to be or get depressed when somebody doesn't show up, because you don't really feel like somebody doesn't want to take care of you. And it's easy to fall in a dark hole. And when this is a pretty common thing, it's tough to dig yourself out of that hole.
And what about you, Renee? How do you use direct care workers, and what happens if they don't show up?
Well, I have care in my home. Well, I'm supposed to have care about 6.5 hours a day. Like I said, I need help showering, I need help transferring in and out of bed, I don't have the toilet, I need help dressing, I need to be fed. Once I'm at my computer, I'm cool. But other than that, I need help with everything. when somebody doesn't show up, my husband, like I said, he's 78 and he has his own health issues and he has to help me. It takes a lot of time for my husband to do my care, something that somebody can do in 20 minutes might take us 45 minutes or a half hour. And some things he just can't do anymore, like give me a shower. And if somebody doesn't show up for 3 days, that means I don't get a shower for 3 days, which usually causes a UTI. So it's very stressful when they don't show up.
So I think starting with Jeremy, what are your two biggest challenges when you're trying to find, hire, and keep direct care workers?
My two biggest challenges, I would say, if I'm able to, I've been trying to utilize like independent providers, and the biggest obstacle is the length of time that it takes to get somebody hired to go through the hiring process through Medicaid. It can take 2 to 3 months easily, and that can deter somebody after just a couple of weeks. Agencies, I pretty much have had it's been impossible to utilize agencies because they're understaffed, they can't find people. And I think the biggest obstacle there is through an agency, it's the rate of pay in which they're compensated. So it's,
Do
you know,
you
the
know how much?
agencies, they don't, I think agencies are at like 9 or 10 an hour. And then if you try to get them through independent provider because they can make more money as an independent provider, you know, they might be at 15, 16, but then the process of hiring them takes forever. So right there, they'll go work at, you know, Walmart and start working tomorrow, or fast food or anywhere, and make 15 an hour, no problem. So therefore, why is somebody going to waste the time to try to become a home health aide?
Have you had providers that it's taken 3 months to get hired?
Yep. Multiple. You know, that same thing with the self-direction program. It's a great concept, but it's not being utilized how it could be.
Mhm.
And we continue to try to have these discussions with Medicaid, but nothing's being changed.
Tammy, what are the two biggest challenges that your sons face when they're trying to find, hire, or keep direct care workers?
For us, one of the biggest is the independent providers don't want to come out to our area, especially for me and Curtis. Nobody wants to come out there. It's way too far in the boonies, according to everybody. And the second would be the pay. It's hard to find people, and like Jeremy said, with the agencies, they're understaffed, or if they do get somebody in there, and sometimes they think that they're coming to do something that it's not. I don't know what some of them think that it is, but it's not what they think, and so they're ready to quit right away. And then the agencies don't have anybody else to replace them with.
Anything else you wanted to highlight?
And I think those are the two biggest struggles that we've been having, is just getting somebody hired, because we live too far east is what everybody says. Nobody wants to go to the east side. That's what our SASs tell us anyways.
And what about you, Renee? What are the two biggest challenges that you've faced when you're trying to find, hire, or keep direct care workers?
Well, I will say I'm a little bit luckier in that I'm not on Medicaid, so I don't have to go through all that red tape. I can hire people on the spot, so they can be hired the same day. But my two biggest challenges is that the pay, I can only pay them between 11 and $12 an hour, and they don't have any benefits usually. Then my hours are split between day and night, like 3 hours in the morning and 3 hours at night. It's not like a full day of work. So that's hard for them. I have had some good aids in the last for 2 to 4 years. The problem is that some of them are not dedicated, and they just think that this is something to make extra money. So they don't understand that when they don't show up, my husband is going to have to try to do it, and he can't do it anymore. So, it's just finding those people that are dedicated. Even when you find them, like I have an aide right now, she's wonderful, but she broke her foot in August. She's been off now ever since. It's been hard. My niece is staying with us right now to try to help out, but she's going home on Friday, and I don't know what we're gonna do after that.
You weren't able to find another provider when your provider broke her foot?
It was that was a miracle. The day before she broke her foot, I hired 2 people to cover shifts that she did not work. So it kind of turned everything upside down. I had coverage for the shifts that she didn't work, but when she broke her foot, I didn't have shifts for her, coverage for her hours. So if I would have hired those people, I wouldn't have anybody at all. But no, I haven't been able to find anybody to cover a shift because it's in the daytime and people work in the daytime mostly.
So we have one more question for our panelists, and then we'll turn it over to folks for questions. The Q&A has been turned off, so if you have questions, please put them in the chat. But first, for a final question, based on firsthand experience with direct care workers, what 2 things do you or the person you represent think would help to end the direct care worker crisis? And Renee, I'm going to have you go first this time.
Well, the big thing is pay. Pay, and I would say benefits. I really would say benefits because medical insurance is so important in this job. I think we need to make it less complicated. Like people want to care for people. They genuinely want to care for people. But when you overcomplicate the system and you don't let them build a relationship with the individual that you're working with, then you're taking the benefit out of caregiving. People get something out of caregiving, but when you make it all red tape, and when you make it so complicated that you just can't get to know the individual and care for the individual as a person instead of a commodity to make money off of. You've lost people who really want to do the work.
Thank you. Tammy, based on firsthand experience with direct care workers, what 2 things do you think would help to end the direct care worker crisis?
Definitely pay is gonna be number one. They don't get paid enough. And number 2, I'm gonna have to agree with Renee, is benefits, because they don't get benefits at all. They're put in as, what is that called? Independent. So they don't get any benefits and they can go elsewhere and make more money plus get benefits. So why would they come and do this if it's easier to do something else and be able to have everything?
Jeremy, what 2 things do you think would help end the direct care worker crisis?
The 2 things that I think would help end it would be, piggybacking what both Renee and Tammy said, would I think is pay. It's a competitive market out there. It was competitive before COVID, and now, especially during COVID, it's even more competitive because people aren't working in general, and how are you going to pull these people out? And there's a lot of genuine people out there that want to help and do home health care, but getting paid so minimum, say we say $10 an hour, you're not able to live a decent life on $10 an hour, and that's before taxes through an agency. And then I would say the red tape, it's a great concept to have people as independent providers. They're their own boss as a contractor wise. They contract through Medicaid, but all the red tape that they have to go through in order to apply, and it takes so long, like I said earlier, it needs to be simplified. And one of the things, I think there's a self-direction program through the state that gives individuals that are able to manage their own care, gives them the power to manage their own budget and set the rate of pay up to a certain rate that your case manager helps you set. It gives you the ability to manage that care, and it should be simple where you hire the people you want to work with, and also gives you the ability to fire people if you need to, and set the hours that you need care. And I'm 38, college graduate. Like, I would like to work and I be involved in the community, but I can't have it. It's so tough to find people to help me get out in the community that I'm not giving back to the community at all, because I don't have the resources that are there to help me like they should be. You know, we all want to give back and be involved and get out and about, but if we can't just do the basics, as in survive, get out of bed, eat, bathe, shower, then what are we doing with ourselves? And it's tough to think that there's people in positions in the state that are aware of these issues, but yet are not working with us as community members to really make that a big difference and change that change the issues that are going on. I mean, it's we can't hide them anymore. These things have to change.
Thank you so much. And what I want to do now is open this for questions. Again, if you could just put your questions in the chat if you have any. I noticed that there have been a number of comments from people in the audience. So thank you for dropping those in there. Any questions for our panelists? You know, we'll take them now. And if there are no questions, then we will wrap this up. I want to thank everybody. Oh, I see a hand raised. Hold on a second. Douglas Fletcher, are you able to put your question in the chat? How about I reach out to you after the forum? And I see lots of comments here. So Kim Kelly put 28 years ago, she began hiring agency DSPs to care for her son. They're making $10 per hour. And in 2021, they are still making $10 per hour. I see some other experiences also dropped in the chat. Thank you guys so much. Nathan Turner, that the lack of public transit makes it difficult for prospective direct care workers to serve individuals in the community outside the transportation service area. 4 separate staffers in the past 3 months have not been able to support me because they would depend on public transit and I live outside of the service area. So, and then he's urging us to support issue 12 next week. Thank you, Nathan. Eric Metzger shared an article Nathan also says that he emphasizes with Jeremy's experience, having difficulty with traditional agency providers and the inefficiency with recruiting independent providers. A lot of people would not mind supporting me, but they have trouble navigating the system and the bureaucratic requirements. And that's what makes Renee's experiences with her providers that she found very unique. We have a couple of suggestions for solutions. Brittany Joseph said a marketing plan for local, to get local folks involved. I think that's definitely something that we would be interested in. Becky Opperman says, my morning aide just quit this morning. Sorry, Becky. Let's see, we have a thank you from Brittany Joseph to all panelists for starting the conversation. For those who are keenly unaware of the real life issues happening in everyday lives. She said she'll do her part to think of solutions on her behalf. So I want to thank everybody for coming. The purpose of this forum is to educate folks in our community. This forum is being recorded. We're going to be posting it on the website and sharing it out. And we're hoping to bring people, especially legislators, on board with coming to some real life solutions to the issue. The Ohio Olmsted Task Force is committed to continuing this conversation with our community and decision makers. Advocates know that fixing these issues will take time and a coordinated effort between the Ohio Department of Medicaid, the Ohio Department of Developmental Disabilities, the Ohio Department of Aging, and our governor's office. But we've come up with some short-term suggestions that the Ohio Olmsted Task Force sent to our agency heads a little over a month ago. In the short term, we need to increase wages and provide reimbursement for training, mileage, and no-shows, provide healthcare benefits, and provide educational incentives for in-home providers. We need to align the certification process for each waiver so that providers only need one certification to provide care to anyone who needs it, and fix the bureaucratic issues that cause delay in providers' ability to get paid for providing services. We need to create a college recruitment plan that draws workers into this field who are called to be part of the disability or healthcare profession, rather than pulling from a pool of workers who are in customer service or food service. And then we also need to extend the emergency authorization that allows family caregivers to get paid as in-home providers. In the long term, we need a multi-agency coordinated plan that addresses these methods for recruitment, incentives, streamlined training and education, healthcare and retirement benefits, respectable wages, and career opportunities to make in-home care into a professional career. But we all understand that's long-term, but there are certainly steps that can be taken in the short term to make things easier. And I know Jeremy's brought up the self-directed waiver option as well, which, if allowed in Ohio, would allow folks with disabilities to have a lot more control over who they hire and how much they make. So we want to thank everybody again for coming to discuss this issue, and we look forward to working together to ensure that people with disabilities have access to the supports they need to remain in the community. For each of our panelists, do you guys have anything really quick in closing to sort of sum up the panel? Tammy?
I agree with a lot of the comments that are coming across the board here. Like somebody said, vote yes for issue 12. We need that public transportation throughout Lucas County, not just Toledo, Sylvania. That's about all I have.
Renee?
I would just say if anybody wants to do this work, they should really look into it. You will help somebody in your neighborhood. That's how I find help is in my neighborhood. And we should do more connecting like that.
Mm-hmm. And Jeremy, any last remarks before we close up?
Well, I just want to say that, you know, there's three of us right now talking about these issues, but to really understand how many people this is affecting out there, you really can't quantify that. I'm, you know, just one of many spinal cord injuries in the state of Ohio that are limited on how much they can do for themselves. And to really put it in perspective of, you know, just think about not being able to do these things on a daily basis, what it does to a person. And this issue crisis, it really is a crisis, because there's people that are suffering and potentially dying because we don't have people caring for us. And it honestly, you know, it really almost wants to make you cry, because it's almost a life or death thing. And for those that want to be out in the community, and just a humane thing of just being cared for, it needs to be made into a professional career, and this needs to be taken a step forward. You know, it's like we said, there's somebody stated 10 years ago, people, the aides are still getting paid the same amount. And how can that even be happening? I know that they just upped the pay 6.1% for agency providers and independent providers. But that's one change over 10 years. I mean, there's so many changes that need to happen. And I just urge as many people as possible to get involved with the Olmsted Task Force, or getting a hold of your legislators to let them know that these things need to be changed, and just keep on pushing and having a voice.
Thank you so much. Thank you to all of our panelists for being willing to share. And thank you for all of our attendees for coming and for being so open to listening. Like we said, this forum is recorded. It will be available on our website. And we look forward to having a continued conversation with local legislators and anybody else interested in causing some change in this area. Thank you so much.
We can close window, press enter.